To conjecture that children will be affected, it's an absolute shooting in the dark where you have no clue what you're saying. There is no evidence, there is no science that children are going to be affected.
Is there any basis to the hypothesis that children will be affected more by this third wave?
To conjecture that children will be affected, it's an absolute shooting in the dark where you have no clue what you're saying. There is no evidence, there is no science that children are going to be affected. In this wave, what did we see? A large number of children affected. Did we see large number? I did see. I saw many children being affected in the large wave also, whom I handled myself and didn't have any symptoms. This time the numbers were much more than last time. I had a 1 year old baby also admitted in our ICU. So we had much more, but the total numbers are also more. So the message out to people is there is no evidence to say that children will be affected. I can think of a very suspicious way of saying this. Under 15 population in India is 38%. And that in a 1.3 billion population is over 400 million. 400 million captive population who can have the vaccine. We as yet don't have a vaccine which is tested in children. We have started the testing. Very rightly so. We are doing it. We should do it correctly. But we don't have a vaccine available in India right now. So if somebody internationally wants to spread a rumor that children are going to be affected, out of parents' love for their children, they'll do anything. They'll spend the money and get that vaccine which is tested in children abroad and give it to their children. And I don't think that this fear psychosis being created needs to be created.
Why did we see this sudden surge in these fungal infections?
No one would have heard about mucormycosis before. You talk to an average doctor 2 years back, they wouldn't have seen a case. As a medical college resident doctor, I saw one case in my 3 years of residency. People say it is from industrial oxygen. There is no evidence of that. If that was so, Gujarat would not have the highest number of cases some time back. They had the highest number. They did not use industrial oxygen cylinders. Maharashtra did not use industrial oxygen cylinders. There were any number of states never having industrial oxygen cylinder hospital getting the infection. So that was not the reason. They were blaming the humidifiers. That is not the reason. The virus is ubiquitous. It is there in your soil. It is there in your plants. It is there in your air. Normally, your normal body has a lot of bacteria. There is a large flora of bacteria in your windpipe, in your trachea, in your bronchi, in your lungs. But they don't cause any disease. But they have another role. They prevent other organisms from coming over and taking over. So their presence prevents that. So when you give antibiotics liberally without indication, and on top of that give steroids to suppress immunity, on top of that there's diabetes, on top of that there's ketoacidosis, you have the setting for mucormycosis. In addition, that's still not sufficient. We think possibly this virus is doing something to your immunity. It is contributing to some immune compromise, and therefore mucormycosis is more common in this setting.